And the first area I want to focus on is the forehead. When we have a look at the forehead, there's actually just one muscle called the frontalis, which is the muscle that's lifting up the eyebrows, and it's the only muscle that lifts up the eyebrows. So we have to be aware of that when we're using the anti-wrinkle injections, because the injections are actually going to stop the action of that muscle so that the eyebrows won't be lifted as much as normal. Just raising your eyebrows up so you can see how the skin is being pulled up, and it's because of this sheet of muscle that is all the way across the forehead. And relax. Now when we have a look at Yvonne, there's a little bit of skin laxity here in the brow. She does actually have quite a lovely high brow there, but we've got to be careful, because if we deactivate this muscle and she can't raise those eyebrows up at all, she may have the feeling that her eyebrows are sitting heavy and that it's kind of drooping down. So we do have to be careful and try to avoid too much of the injection in these areas here so that we don't drop the brow down. Now Yvonne has said to me that she actually does want to have a little bit of movement. She does want to raise her eyebrows up and be able to have some of that expression. Sometimes I have people say to me that they don't want any movement. They want to have a nice frozen forehead. But in Yvonne's case, she wants a little bit more movement. So I'm actually just going to use less of the anti-wrinkle injections. So I'm going to use just 5 points of injection across that frontalis muscle. So what I'd like you to do, Yvonne, I'm just going to just clean and cool down that area. Okay, now I'll get you to raise your eyebrows right up. What I'm looking at is really where the movement is happening within that muscle. Just a little sting now. Good. And again. And again. Okay. Good. When we're looking at somebody's frown, there's two different muscles that are actually involved in a frown. There's a muscle here called the procerus, and then there's two thin muscles that run along this area called the corrugators. And when we contract them, that's exactly what they do. They tend to corrugate the forehead. So just give us another big frown, and you can see it's actually pulling right from here to about here. That's the corrugator working all the way along there. The procerus is not doing a whole lot in this case, but sometimes you see it, it's like a big bulge contracting there, but we're still going to hit that area. Big frown for me, and relax. Big frown again. Okay, so now we're coming down to the crow's feet. With crow's feet, what we're actually treating is the circular muscle that goes around the eye, orbicularis oculi. Now, it's all one muscle that runs in a circle, and it actually contracts inwards, so that when we smile or squint, the fibres of the muscle bunch together, and that's why we tend to get the lines running across the muscle. Give us a nice big smile, and you can see the bunching that's happening around that area. What we want to do is we want to soften the movement of that muscle in this part. We want to soften the intensity of the lines, but we don't want to stop movement completely, and we have to also be very careful because it's a very fine muscle. If we actually go underneath the muscle and hit one of the other muscles underneath, we may deactivate that one, and that could be one of the muscles that's involved in lifting up the cheek when we smile. That gives us the nice rosy high cheeks when we smile. So we don't want to deactivate that muscle. So I do tend to always go very light and very superficial in these lower lines. Another thing that we can treat when we're using anti-wrinkle injections around the eyes is oftentimes people will say that they want a little bit of a brow lift. As I said, the frontalis muscle is the only muscle that lifts the eye up, but the orbicularis oculi muscle actually pulls the eyelid down, so that when we smile or when we squint, when we're looking into the sun, it can tend to pull that brow down. Sometimes when you get photos of yourself, you just see you've always got these slitty eyes because the eyebrow is pulling right down. So we can actually relax that part of the muscle with the anti-wrinkle injection. So it just helps to open up the eye. We obviously don't want to do too much so that it's very relaxed and then this muscle's pulling up and we're doing this kind of thing. So we don't want to do that. So you need to go lightly, but you're just softening the movement of the muscles around this area. Squint down like you're looking into the sun and relax. And again, and relax. You've got a few little lumps there, but they'll actually disappear over the next half an hour. Now coming down to the lower half of the face, we're treating the muscle, as I mentioned before, that actually tends to pull down the corner of the mouth. Now this is really more a preventative kind of treatment. It's not one that you notice particularly, but it's relaxing that muscle so that over time that you get less of a fold forming in the corner of the mouth. So what I'm actually going to do is I'm just going to mark out where we treat. So we tend to follow the line down from the nasolabial. Now when we're treating this muscle, we have to be very careful and go very superficially. There are actually quite a lot of muscles around the mouth that are very important for movement, expression and even speech. The way we enunciate our words is very much reliant on how we use each of those muscles. So we have to be careful that we're just going to be treating this muscle. So what I want you to do is to just try and show the bottom teeth and really pull that, sort of like a weightlifter look. It's just a little bleb, a little sting there. Same again, pulling down the corner, beautiful. And now we're treating the mentalis muscle. This is the muscle that is basically forming the chin. The mentalis muscle is quite broad at the surface of the skin. It often causes a lot of dimpling. Just fold your chin up, sort of, can you dimple up? No, fold it up. That's it, beautiful. And you can see all the dimpling. So that muscle actually attaches to the skin in quite a broad area. But again, you can relax now. But again, there's other muscles around the mouth, so we have to be careful not to come too far up. We don't want to deactivate the muscle that goes around. We're just wanting to stick to the chin, so we're going to tend to treat lower down. Again, quite superficial, because you want to get all of those strands where they're attaching into the skin. Good, okay. So now we've done the areas that we wanted to do with the anti-wrinkle injections. There's not really much that you need to do in terms of aftercare. We do suggest that you don't go and have a facial treatment or go and do any very rigorous exercise in the next 24 hours. We also suggest that you stay upright and don't go to bed for the next 4 hours. It's going to take between 5 and 10 days for the anti-wrinkle injections to start kicking in, and the full effect will be seen by 2 weeks. At that point, I usually like to get you back just to make sure that you're happy and that I'm happy and that everything is working as we like to see and nothing needs to be adjusted.